you have fibroid tumors. They're large, but you're not having any abnormal bleeding. Your periods are regular. They're lasting less than 3-4 days. You're not going through multiple pads or tampons in a day. You're not anemic. Your ferritin level is normal. Your vitamin D, you don't know about that. Should be checked. But anyway, you know you have fibroid tumors because you can feel them. Your partner can feel them, but no abnormal bleeding. So the question is, should you be concerned? The answer is yes, because abnormal bleeding is not the only symptom associated with fibroid tumors. Imagine this, a large fibroid tumor pressing on your bladder might cause urinary symptoms, urinary frequency. Or consider this, you have a large fibroid on one side. You might experience left or right-sided abdominal pain because of the fibroid. Or the fibroid is actually pressing on your ureter, which is essentially the tube that leads from your kidney to your bladder. And that can lead to something that we call hydronephrosis, when the kidney actually starts to swell due to the compression. Or you could have a fibroid that's starting to press on a blood vessel that puts you at risk for developing a blood clot. So all these issues are real. And the other one that we need to mention is, well, there's two more. The fibroid may very well be the fibroid may interfere, the fibroid could very well interfere with your ability to get pregnant. Again, that's dependent on the location and size and number of fibroids. And then there's the other aspect where it's just embarrassing to look like you're pregnant when you're not. It's embarrassing to have to try to dress in a way that you don't have people coming up to you asking you, how far along are you? And so these are real concerns that women with large fibroids encounter, and they don't necessarily have abnormal bleeding, but they do have issues, and they do warrant further evaluation and management. And again, the management will depend on size, number, location, what specific symptom are you having, your concerns about fertility, your age, your health status. All of those things need to be factored into the equation, because one size doesn't fit all. So you need a full evaluation. You need a full evaluation. You need a consultation with your GYN. And the advice to wait till you're symptomatic has usually meant wait until you're bleeding. But again, bleeding is not the only symptom associated with fibroid tumors. Now, when we talk about large, exactly what size am I talking about? It varies, but usually an arbitrary number, 7 centimeters, is usually expressed as anything 7 centimeters or greater, consistent with a large fibroid. Or some people will say 5 centimeters or larger, large fibroids. But basically, when you are at the point where you can feel your fibroids, consider them abnormally large. And the other issue, besides the compression from the fibroid in your pelvis, the fact that you have this social stigma, maybe because you're embarrassed because you look pregnant. And then there's the issue of pain, depending on where this fibroid is located, the size of the fibroid. There can be pain associated with penetrative sex. So these are all issues to consider. So do nothing is not an option. We need to talk about it more. We need to be aware. We need to be more supportive of each other. We need to share our experiences to let others know you're not alone in this issue, because fibroids are oh so common. I'd like to hear from you. This is Dr. Rahman saying we are going to continue discussing fibroids, because it is such an important issue, because it does affect so many women, and particularly Black women. And so until the next time, take care.